Let's talk a little bit about recovery after liposuction, and I'll put in some information about fat transfer as well. Um, there's A, B, C, and D. A is acute. That's the first 1 to 3 days. B is the bruising phase, the first 3 weeks. C is the cautious phase, 3 weeks to 6 weeks. And then, for lack of a better D, I made up do it. So at 6 weeks, it's do it, no restrictions. So let's go over what those mean. So A, acute. That's the first 1 to 3 days. Everybody's a little bit different with this. That's when you're going to be taking narcotic pain medications. If you need them, we prefer you don't take them. You're going to be draining a lot for those first 1 to 3 days. A lot of fluid that we put in there is going to come back out. We'll provide you some information about how to take care of that and some supplies, because that can be a tough part of the early recovery. You're certainly not working and you're not exercising at that point of time. The next is the bruising phase. That goes from that point up to about 3 weeks. These first 3 weeks, you're not sitting on your buttock if we've had BBL. You're not laying on your chest if we've done fat transfer to the breast. You're not laying on your backside. You're sleeping, on your belly if we've done BBL. Basically, you're trying to avoid pressure to those areas and body weight pressure to those areas. We'll provide you a pillow to sit on if we've done BBL. That's the time that you're, that after the acute phase, during that bruising phase, that's where you're back to being mom. That's where you don't need help at home anymore. That's where you can go back to a desk job. Most employment is fine, although a little bit uncomfortable. And then you get past those first 3 weeks. Now we're going to let you start to put your body weight on those areas if we've done any fat transfer. This is the cautious phase, 3 weeks to 6 weeks. If you have a physical job, you can get back to it. If you want to get back to exercising, you can do it, but you're being cautious with both of those things. We're not really fully getting back to the gym. Maybe a good walk, certainly a jog is okay, lightweight lifting. That's a good point to get into a second stage garment. So you might find that the first stage garment was uncomfortable and you want to get into something more like, Flexies or Spanx or something like that that's a little bit more comfortable. The idea of those garments is just to provide a little bit of pressure to help with swelling and mostly with comfort at that point. They don't do a whole lot to give us our final results. It's really just about your comfort and getting you healed a little bit quicker. And then there's full recovery, and that's at 6 weeks. Now, that doesn't mean full cosmetic recovery. We're not there yet. We've still got swelling. It can still be a little bit disappointing, even cosmetically, where we're at, because we haven't quite seen that full result. But that's where you can do anything you want. Full employment, no matter what your job is, full exercise, no matter what that entails. And then full cosmetic recovery is really closer to a year. It's a little bit different for everybody, but we're waiting for that final year point to know what last little bit of it is swelling and really see where we end up. So I hope that helped a little bit with a little bit of information about recovery after liposuction.